Medical malpractice cases are some of the most complex legal battles in the healthcare system. At the heart of nearly every malpractice lawsuit lies one critical piece of evidence: the patient's medical records. These records serve as the primary documentation of what care was provided, how it was delivered, and whether it met the standard of medical practice. Without complete and accurate medical records, it is nearly impossible to prove or defend against a malpractice claim. In this video, we are going to explore the vital role medical records play in malpractice lawsuits, why they matter so much, and how they can ultimately decide the outcome of a case. To begin, let's define what medical records actually are. A medical record is a detailed account of a patient's history, examinations, diagnoses, treatments, prescriptions, test results, progress notes, and communications between healthcare providers. These records can be electronic or paper-based, and they provide a chronological story of a patient's journey through the healthcare system. Every action a doctor, nurse, or hospital takes should be documented, making the record a comprehensive reflection of the patient's medical experience. In malpractice lawsuits, the medical record is often the first piece of evidence that attorneys review. It helps answer critical questions such as: was the correct diagnosis made in a timely manner? Were appropriate treatments given? Did the healthcare provider follow standard procedures? And most importantly, were there errors or omissions that caused harm to the patient? The record doesn't just tell a story, it provides measurable proof. One of the key reasons medical records are so important is because they serve as an objective reference. Memories fade and personal recollections can be inconsistent, but a record created at the time of treatment is considered a reliable account of events. For example, if a doctor claims they performed a specific test, but there is no documentation of it in the record, that absence can raise serious doubts. Similarly, if a nurse's notes show that medication was administered late or incorrectly, that information can be used to establish negligence. Another crucial role of medical records is establishing the standard of care. In malpractice lawsuits, the question is not whether a doctor made a mistake, but whether the doctor's actions deviated from what a reasonably competent professional would have done under similar circumstances. Expert witnesses often rely heavily on medical records to compare what was done with what should have been done. For instance, if a patient presented symptoms consistent with a heart attack, but the record shows no diagnostic tests were ordered, this could demonstrate a deviation from the accepted standard of care. Medical records are also vital for proving causation. In legal terms, causation means linking the healthcare provider's negligence directly to the patient's injury or harm. It is not enough to show that a mistake was made. It must be shown that the mistake caused damage. The records provide the timeline needed to establish this connection. For example, if a delay in diagnosis allowed a condition to worsen, the record can show when symptoms were first reported, when tests were ordered, and when treatment was finally provided. That timeline can make or break a malpractice case. In addition, medical records serve as a defense tool for healthcare providers. Doctors and hospitals often rely on detailed and accurate notes to show that they acted responsibly. If a provider followed correct procedures, but the patient still suffered complications, the records can demonstrate that the provider did everything within reason. In some cases, strong documentation is the best defense against false or exaggerated claims. However, incomplete or inaccurate medical records can severely damage a case. Missing notes, vague descriptions, or inconsistencies between different providers' records can raise suspicion and weaken trust in the healthcare team. Even simple errors, like illegible handwriting or misfiled reports, can cast doubt on the overall credibility of the care provided. In legal proceedings, gaps in documentation are often interpreted in the patient's favor. Medical records also raise important legal and ethical issues. Patients have the right to access their own records, and in malpractice cases, attorneys will often request them through a legal process called discovery. Healthcare providers are legally obligated to maintain accurate records and preserve them for a specific period of time. Altering or destroying records after a lawsuit has been filed is considered tampering and can result in severe penalties, including loss of license or criminal charges. With the widespread adoption of electronic health records, or EHRs, new challenges and opportunities have emerged. EHRs provide detailed timestamps that can reveal when entries were made, who made them, and whether changes were made after the fact. This transparency can help establish an accurate timeline, but it also means that any suspicious alterations can be detected more easily. In malpractice cases, metadata from electronic records is increasingly being used to prove or disprove claims. Beyond their role in litigation, medical records highlight the importance of strong documentation practices in healthcare. Many malpractice lawsuits could be avoided if providers documented more thoroughly, ensuring that every step of care was clearly recorded. Good documentation not only protects patients by ensuring continuity of care, but also protects healthcare providers from legal risk. To summarize, medical records are the foundation of malpractice lawsuits. They provide a factual account of patient care, establish the standard of care, demonstrate causation, and serve as both evidence for patients and defense for providers. Inaccurate or incomplete records can undermine a case, while thorough and transparent documentation can be the deciding factor in whether justice is served. Ultimately, the role of medical records in malpractice lawsuits is not just about legal evidence. It is about accountability, patient safety, and trust in the healthcare system. For patients, it reinforces the importance of understanding and accessing their own medical history. For providers, it emphasizes the duty to maintain accurate and detailed records as part of their professional responsibility. And for the legal system, it underscores how a single chart, note, or timestamp can be the key to uncovering the truth.